Let's talk about bunions. I get a lot of questions. What are bunions? What are they? I have this little bump on the side of my foot. So let's explain what a bunion is. Let's look at this chart right here. This is a normal foot right here. As you can see, the angle between these two is supposed to be under 8. And this one looks really good right here on the chart. You see that the angles are nice and straight. These two bones are almost parallel. Now let's go over to the bunion. The bunion is a deviation of these two bones. This is number 1, number 2, big toe, second toe. So it's a deviation of the joint going out this way. So you get the little bump right here on the side that you see. So it's not really a calcium deposit as people think it is. It's actually more of a deviation or angulation difference between number 1 and 2, separation of the two, causing the toe to go out. Now, there are different kind of causes for bunion formation. Number 1 is inherited. And the question is, the foot type is inherited, but the bunion typically is not inherited, but the foot type is. And what it means is that, if you have a family of people with flat feet, and people with flat feet tend to get bunions because when you flatten out, the first metatarsal also fans out. That's why you see a lot of people with flat feet with very bad bunions, where the bunion crosses over or under the second toe. That's called overlapping or underlapping bunion. Now, there's also controversy on when you should do a bunionectomy. Some old-fashioned doctors say, hey, if it doesn't hurt, don't fix it. Well, here's the problem with that theory. I have patients in their 70s and 80s coming in, hey, my doctors told me 20 years ago, it doesn't hurt, don't fix it. But now they're coming in with a lot of pain and a lot of arthritic deformity in this joint. Now, if you can imagine, let's say, the best analogy I give my patients, let's say brakes and a rotor. If the rotor is uneven and the brakes are wearing uneven, you're going to get more uneven wear and tear. So if the joint is like this and uneven, it's going to have uneven wear and tear on the joint on both sides. So you're going to get some arthritic formation. So my suggestion is, if it's big enough to bother you in shoe wear, if it's big enough to bother you in the type of shoes that you wear, and it's bothering your life, and you see that big horrible bump coming off the side, sometimes gets red and inflamed, I would say it's about time to see a podiatrist and get some opinions about what you should do. Now, I'm a little bit more aggressive with the bunionectomy just because we're able to do it with very minimal incision right nowadays with a minimally invasive bunionectomy. So there's really very little side effect, if any, to this bunionectomy. You'll see some videos on a website, scarlessbunion.com. Basically, I make a small little incision on the side, take a little cut with non-power is a chisel and hammer, old-fashioned chisel and hammer. That way I don't cause bone burning of the bone. And then I'm able to shift this bone all the way over, this whole piece over, and do the realignment of the toe. You'll see some videos, you'll see some pictures. Proof is in the picture, it's worth 1,000 words. So again, that is why a bunion is formed, that's what a bunion looks like. And if you need a bunionectomy, consider a scarless bunionectomy. The traditional bunionectomy works well also, but you are opening up a large incision from here to here, and we do have some chance of joint damage, nerve damage, soft tissue damage. That is a typical part of the risk and complication of any type of surgery. We minimize that with the minimum invasive bunionectomy because I'm only making less than a 6mm incision, and we're able to do that in the safety of the office under regional anesthesia. And patients really walk out of the surgery with a surgical boot. You wear that for 6 to 8 weeks. So check out my website, scarlessbunion.com. Any questions, let us know. This is the OR for the Peabody Lamb bunionectomy. Patient is being prepped right now. Let's go in and take a look and go through the process. Patient's already been pre-numbed before she comes into the operating room. Heading on in, we are prepping the foot for the bunionectomy. Right about here. This is the bunion. We're gonna take out today. Say goodbye. Any last words for the bunion?
Yes, and I can't wait for you to be gone and never see you again.
Great. Well,
wear shoes.
Came from us from Louisiana.
I am about 30 minutes from Louisiana. I live in Bay St. Louis, Mississippi.
Well, we'll get this.
I'm just across the bridge.
Good. Well, let's get it done. We're getting her prepped. She's fully numb now. Am I correct? You're fully numb now. You can't feel your foot.
Oh Lift your foot up for me, please.
So the staff's already prepping her already. She's getting prepped, antimicrobial prepping. She's already pre-numbed already before she came into the operating room. We have all supplies ready. This is our C-arm, which is our X-ray machine, and Zuli, right there, my medical assistant. We're gonna go right here. That's our tourniquet system. Let's do this. The numbing wasn't too bad, was it?
No, not at all.
Okay. Well, we'll take another peek at this after I'm done. Sounds fair? Okay. Well, this is the pre-op. This is pre-op. She's already been prepped, surgically draped. We're dealing with a bunion right here and a Taylor's bunion right here. It's more appreciable on the X-ray than it is in live person. But when we get ready to get scrubbed, and we'll take an X-ray during surgery. You see that little bump right here, and that's called a Taylor's bunion right here. That's a regular bunion. Let's get this taken care of.
Wow.
Say smile. Can you see? Let's set her up and let her see your bunion. This is right after. That's your incision. There's your bunion.
Well, all right.
Let's turn the it went away. What do you think?
Well, I want to know if afterwards is this toe going to be?
Yep, it will. It will.
Okay.
Yes, it's just overcorrected right now on purpose.
Oh, okay.
Because that pin is in there. While the bone heals, once I pull that out, it's going to be perfect. So it took about 15 minutes, 12 minutes total. Get it done.
Yes.
So we're all set. Bunion is gone. No more. Right here. 7 weeks actually, not 8. We're only 7 weeks
June
post-op.
18th.
Okay. Well, this was from before we did the before video before of this foot right here. This is the after. She is here, good range of motion, back in sneakers. Am I correct? She's doing very well. She still has some swelling in here, which is expected at 8 weeks, 7 to 8 weeks. So she's back for the right foot. As you can see, nice big bump right here. Although not as big as this one. This one was really big pre-operatively in the video prior to this. So we're gonna go ahead today. She's all numbed up already. I did a block right here, a block right here, and a nerve block up here. That should numb up all the whole leg that I need to do the bunionectomy, so she won't feel a thing. Now, last time when we did this surgery, did you have a lot of pain afterwards,
I
recovery-wise?
had no pain whatsoever. It was very tolerable. I didn't have any issues.
Traveling wasn't a big deal, going back and forth to home and everything else, right?
I had no problems. I'm so excited. That's where I'm going to have the other one.
Well, the scars right here and right here, that's about it. Everything healed up very good. Thanks for painting your toenails for me right here. This one, we're gonna get it done and make it match. Okay, any questions? Okay, we're
I'm very
ready.
excited. I'm very happy with the first one.
Well, at 7 weeks out, you're good to go on this one, and we're gonna do this one now.
Yep.
We're gonna finish, make a match now. Awesome. Hi everyone, this is Dr. Lamb again. Doing a follow-up on the Peabody bunionectomy. In the video, in the beginning, I showed you a big bunion. It's a patient from all the way from Mississippi, Louisiana area, and she came in specifically for the Peabody, which is minimally invasive bunionectomy. And the reason why I appealed to her when she did her research online is the minimally invasiveness, one stitch, able to walk immediately, no pain, and ability to correct a large deformity with a small incision. Therefore, we don't have nerve damage, tendon damage, or complications such as a non-union. So this definitely cuts down a lot of the risks of bunion surgery and a lot of fear of bunion surgery, which is of pain and disability afterwards. The patient is only 7 weeks out. We're going in to do her right foot. She's in her sneakers at 7 weeks out, the left foot. It was a severe bunion. If you look at the video before, now we're going to take a look at her in the operating room just prior to her right foot surgery at 7 weeks. Awesome patient. She's doing really well. She's excited, and she drove all the way back from Mississippi to get the minimally invasive bunionectomy done. So a lot of times I hear people say, hey, I don't want to get my second foot done because it's painful from my first experience. That's what I hear from a lot of patients who had one bunion done, didn't want to get the other one done. But in our case, it's different. Minimally invasive, I see patients coming back all the time for their other foot to get done because the recovery was fairly simple in majority of cases. So enjoy the video.